Today is the 10th of February 2024. So today we're going to talk about treatment of obesity. But in the meantime, let us talk about what obesity does to the body. So we all know that aging is a process. So when you're going through aging, basically your body is not communicating like it used to. The cells are not communicating like it used to. That's why when people get older, they're more prone to metabolic diseases, cancer, and all that, because the cells are not working like they used to, and they're not repairing when there's a damage. So basically, the cells are made up of three most important parts. You have the nucleus, where your DNA is stored. You have the mitochondria, where the energy is produced. And you have the lysozyme, which basically excretes the metabolic products from the cell, which is like how our body works. We have the brain, which stores most of our activities and our memory, which basically is what the nucleus looks like. And you have the heart, which is what looks like the mitochondria, because that's where the blood is pumped from, and they send blood everywhere to our part of the body, and we can function. And then we have our liver and our kidneys that excretes our products. Now, what happens is that when the cells are not working like they used to because of aging and stress, basically the excretions like they should do, like the mitochondria, make energy and products are being made, excreted through the lysozyme, it's not flowing like they used to. Then the cells are started to become damaged and harmed, and they're not repairing as fast as they used to. That's basically what aging is all about. And that can predispose you to a lot of diseases, which include diabetes, hypertension, cancer, liver disease, kidney disease, and all that. So basically, that's where we're talking about obesity, because obesity basically is a way that you age faster than you should. Because when the fat is deposited on your body, it's not just on. I know you can see yourself become bigger in your face, your neck, your abdomen, and things like that. But it's also deposited in all parts of your body, including the cells. So basically, what fat cell does is that it makes the cell not work as it should have if they were functioning at a normal speed. So basically, what you've done is you've increased the likelihood of your cell getting more damaged than it should if they were not being affected by those fat cells, affecting their function. So what it does is that it makes you age faster than you should. That's why when somebody is obese, they develop all those diseases earlier than they should have if they were not. So somebody who's very obese, maybe 400 pounds, 500 pounds, you see them developing diabetes at age of 30, 35. You see them developing cancer at age of 30, 35. And you see them that the cells are not well regulated like they should, because they're not functioning at optimal level like they would have if they have not been disrupted by those fat deposits and all that's affecting the whole system. So what happens is that when you are in that frame of being very obese, you are putting too much pressure on your cells, and the cells are not going to function like they should. And that's why you get sicker earlier, you age faster. And that's what we're going to do today. We're going to try to find a way to help you with this obesity problem. How to prevent obesity, how to treat it, and how to get checkups. And if you're taking medication, the kind of things you should expect and the kind of checkups you need to go through. I always say that a normal human being have close to about maybe 75 trillion cells, 75 to 100 trillion cells. Those cells are in the bones, those cells are in your liver, those cells are in your heart. I mean, they all do different function in so many ways, but they all act, but they all communicate. And one can be better than the other, one can die faster than the other, but at the end of the day, the body tries to generate and replace any dead cell as fast as it could to keep you in a very, very good state and you function like you love to. So the fat cells add up to those nuisance that the cells in your body do not want and consume their energy, make them weaker, and make them not to repair as they should, and that will result in you having multiple problems. That's why when somebody is having fat deposits in the receptor of the muscles, they develop insulin resistance because the insulin is not going as it should into the muscle to improve metabolism of glucose. And that's what diabetes basically is all about. So when you hear of type 2 diabetes, basically what it is insulin resistance. And that's why when you give somebody more insulin, you try to combat a resistance in those muscle cells. But that can also cause other harms. And that's what we're going to talk about how to prevent obesity and how to treat obesity. And I'm going to come back in 5 minutes to talk about prevention of obesity and treatment of obesity. Thank you and God bless. See you soon. Okay, so I'm back again, and don't forget to see us in the clinic at Synergen X in Indianapolis and Greenwood, or in my private clinic, Apico Healthcare. But most of our treatments for obesity happen with Synergen X. I work with some nurse practitioners there, and in my next episode, I'm gonna be with one of the nurse practitioners. So we're gonna talk about treatment, including weight loss treatment and things we do, especially hormonal therapy. But in the meantime, where I stopped about how obesity affects aging and how your blood sugar is disturbed if the receptors in your muscles are not working at optimal level because of fat deposits, and how you need to have more insulin to combat the resistance, because resistance comes in different ways. You know, when if I'm holding my hand this way and I'm trying to push through, I'm using this arm to cause a resistance. Now, if I want to bypass this resistance, I need maybe 4 more arms to push away this so I can be able to bypass the resistance. And that's what basically adding more insulin does. It gives you more power to bypass a resistance. And that's what insulin resistance is all about. And that's why, you know, what we're going to try to do is how do you reduce those resistance so we don't need to add more insulin. All you need to do is when insulin comes, it just goes to the muscle and go inside and metabolize glucose. Because whether you are active or non-active, your body, your muscles will always going to need sugar, and it needs to be metabolized. And sugar cannot be metabolized without insulin. So even at a resting state, you are breaking down calories. At least at a resting state, you are breaking down maybe about 1,500 calories every day without even being active. If you're active, that adds about 600 to 800 calories to it. And those calories come mostly from sugar. So if you eat a lot of calories, that's gonna give you fat deposit because those calories are stored in the fat. So what are we gonna do to reduce this obesity? We've talked about exercise. That's my always go in tactics to exercise, and we talked about dieting. Sometimes those are difficult. Then if they are difficult, what else can we do to help you with dieting and exercise? We can try medication. And if there's any metabolic issue that needs to be fixed, whether it is hypothyroidism, whether it is adrenal issues, whether it is pituitary issues, things like that, we need to fix that. Because if you have an imbalance, whether it is hormonal imbalance, anything that decreases metabolism, that will give you obesity. And if you don't fix it, it is very, very difficult to accomplish the goal. So that's what we do. I mean, that's why there's a special clinic for obesity. And a lot of Americans are obese or overweight. We talked about 1 in 3 to 1 in 5, 1 in 3 to 1 in, so almost 1.5 of Americans are either obese or overweight. And either way is a problem because, like I said, obesity is when you have BMI above 30, overweight is when you have BMI between 26 and 30. Now, what are the medications you could use to treat obesity? Now, the one that is going on everywhere, which I'm sure 90% of Americans have heard about, is Ozempic. It's called GLP-1 analog. Basically, these are natural products that the body makes to help you release insulin in your, from your pancreas and, help you with not getting, let you know you're full and all that. So it's processed and change some of the products there, and now what they call Ozempic. You can call it Wegovy. It's semaglutide. Some places, usually is a shot that is given once every week. You have Riselbus, which is basically an oral tablet of it, and that is taken once a day. So Ozempic is one that we know. We have other ones called Mounjaro, or in some, basically what it is that there's a peptide, which is which works just about the same way as a GLP-1 as well, and it helps in reducing your appetite, so you feel full easily and you don't eat too much. And we also have other medications that most people don't talk about anymore, like Orlistat. Orlistat is a lipase inhibitor. What is lipase? Lipase is basically a product made in the pancreas that helps in metabolism of fat. So when you eat food, it stimulates the pancreas to make some enzymes that digest the food. The Orlistat, when you take it, it inhibits the lipase and then prevents you from absorbing fat. And in that way, you pass those fats in your stool. That's what lipase does, and that's what Orlistat does too. Prevent the enzyme that is produced in the pancreas, called the lipase, from functioning. So we also have what they call phentermine. Phentermine we use a lot in the clinic. It is a controlled substance, and we usually give about 37.5 milligrams once a day. It increases metabolism. The side effect is that it can make you shake, because it basically works like almost like an adrenaline, and it can give high blood pressure, and it increases your body to make your body metabolize faster than it should. I've talked about Orlistat, which is the one that inhibits the lipase and make you not absorb fat, but that one makes your stool very oily, because those fats, instead of going to your system, is being passed out through your stool. So we have what they call Contrave. People have used Contrave. That one is not common anymore Basically, it is Wellbutrin, which is an antidepressant, and naltrexone, which is what you give to people who have alcohol issue. It is also used for people who have problem with opiates. You combine the two, 8 to 2, and then you give it to the person, and it's an appetite suppressant, and it helps for those who are pleasure feeding because of depression. It works well with them. We prescribe that as well. But of all those things that we talked about, none of them is better than diet and exercise. And when you're dieting, when you're exercising, you have to make sure you take the appropriate food with it, supplements like vitamin D, vitamin C, vitamin E. These vitamins are very good antioxidants. They help your cells regulate what is there and prevent them from having excessive injury. Because when the cells are going through excessive injury, that could lead to damage of the cells. And I said, like aging, like having cancer, like having hypertension, like having chronic inflammations, whether it is autoimmune diseases. And I'm sure most of you have heard of autoimmune diseases, which ranges from rheumatoid arthritis, systemic lupus erythematosus, sarcoidosis, things like that. These are your body creating an antibody fighting your own body and causing a lot of inflammation in your body. And those things make you, die faster. They decrease your lifespan because inflammation is a killer. When your body is inflamed, your cells are not functioning well because they have a lot of holes in it because they're all wet. The membranes are wet and it's not communicating like it should. It's not working at optimal level, and the damage from one leads to the other. That's what they call free radicals. Free radicals are very high in those people who have inflammation, and those free radicals have been known to be a major cause of whether it is accelerated aging, whether it is developing cancer, metabolic diseases, tumors, whether it is benign or cancerous, whether it is polyps in your colon, whether it is benign tumor in your brain, and things like that. They are a very good cause of all those things. And that's why, those things happen as people get older. Because as you get older, once you are above certain age, like 25, 26, 27, 28, because aging really starts at the age of 30. Once you hit that 30 level, your body is not repairing as fast as it used to be. And the growth, because initially your cells are dividing and growing, just like a child grows, and you see him jump from being a 1 feet child to 2 feet, 3 feet. The whole idea is that the more cells are being made than the ones that are dying, and the child is growing. At some level, it doesn't happen that way anymore, and that's the global picture of the body. And anything that distorts that pattern causes danger to the body because you've changed the structure of the human growth and human being, and this leads to diseases that are difficult to control, excessive growth that cannot be regulated, which is basically what cancer is all about. Cancer is just your body, some part of your body just started creating a growth that your body cannot take care of, and just keep growing and growing and growing. Basically, it became, let's say, mortal cells, and it's difficult to treat that. So anyway, there's in addition to all this medication I mentioned, diet and exercise, there are other types we can use, which is hormonal treatment. Checking all those deficiencies that can create a problem in your body being able to metabolize like it should. And that's what we're going to talk about in the next episode. Those replacements, hormonal replacements that are very important, things that we can measure and treat to encourage the body to work the way it should. Thank you and God bless. Bye.